Let's talk about sinus infections and sinus migraines. A lot of people think, especially this time of year, that they're developing sinus infections and they go run to the urgent care of their doctor and get a prescription for antibiotics, azithromycin, Z-Pak, whatever it may be, and actually they're experiencing migraines and don't even realize it. I'm Dr. Philip Oob, a practicing medical doctor, family practice trained, and practicing here in Austin, Texas. And I want to tell you a little bit more about sinus migraines, some things that you may not know. I rotated with an ENT in residency, and I thought he was crazy when he looked at me and said, 25% of the patients that I see in my office for chronic sinus infections actually have sinus migraines. And I literally thought he was crazy until I followed him around for a few days to a couple weeks. And I noticed, sure enough, he actually was kind of practicing neurology. He had a bunch of patients that were following him who he diagnosed with migraines and was giving migraine medicine to, and their infections were getting better. This is something that's not widely known, and I've seen several patients, including one this week, who has had chronic sinus infections all her life. Started even as a teenager, and she would take antibiotics and it wouldn't really get any better. She'd have to take a more powerful antibiotic. It wouldn't really get any better, and then it would just kind of magically go away at some point. But she was always told it was sinus infections. And then she goes into later in life, and so they start doing CT scans, and oh, there's the mucosal inflammation, there's the mucus, you've got another sinus infection, let's put you on some powerful antibiotics. And then it got to the point where the antibiotics weren't working and she was suffering. So the next step, of course, is to go inside the nose and do balloon sinuplasty, cut septums, do whatever they might do for chronic sinus infections. And lo and behold, by the time she came to me, as many of you are already expecting from this story, her gut was a complete wreck, and she was suffering from so many other problems in addition to the chronic sinus infections that well, I guess we'll leave the gut issues to another story. But the moral of the story was that she was not having sinus infections at all, and she was actually having sinus migraines. So we had a long talk about things that trigger migraines, things that can improve migraines, and it turns out that she had already drastically improved her chronic sinus infections by the time she had come to see me. She was seeing me for some of the other stuff by going paleo. She actually ate a paleo diet, which, as many of you know, is a gluten-free, dairy-free diet, and so her sinus infections got better. Do you think that had anything to do with bacterial infections? No, it's because she was actually experiencing sinus migraines. So sinus migraines can look the exact same as a sinus infection. In fact, clinically speaking, there's no difference. You get sinus pressure, you can get sinus drainage, you can get mucus, you can get headaches. You're not necessarily going to get all the classic findings of a migraine headache. You may not get the blurry vision, the double vision, the auras in your eyes. You may not actually get a headache somewhere else other than in the sinuses. And the reason why you get these same symptoms with a sinus migraine is because extra blood flow runs to the area. So then you get extra snot production and extra pressure in the area. And so it feels just like a sinus infection, but it's actually a sinus migraine. One thing I'll often do with patients is, if they don't really believe me, and many of them don't believe me, that they're having a sinus migraine, I'll give them migraine medicine in the office and say, you go home, you rest, you relax, and if your headache, sinus infection, whatever it is, goes away in the next 12 hours, it wasn't an infection because we gave you no antibiotics, it's just a migraine medicine. That usually wins people over, because even if the migraine doesn't go completely away, it actually improves some, and then usually they're willing to at least listen a little bit more about sinus migraines. My most successful sinus migraine story was actually a coworker. I can't say her name, but it was a coworker from several years ago, and by the time she had seen me, she had already had sinuplasty and multiple rounds of antibiotics, and she had actually come to see me that day because she said she had a sinus infection and wanted antibiotics. And I basically told her she had a sinus migraine, and she literally looked at me like I was crazy. So over time, she believed me, and she realized that yes, the migraine medicine worked way better than any antibiotic ever did, and no one had to go in and balloon open her sinuses. And I think she's at about 2 years now where she's pretty much migraine free, except for when she drinks caffeine and stresses too much. She knows her triggers, and then the migraines start coming back, and she just kind of gets back on her train and her migraines go away. So she's a firm believer, and I'm hoping you're getting the picture here. If you're someone that struggles with migraines or sinus migraines, then the first tip I would tell you is go gluten-free. So many people's migraines have gotten completely better just by removing gluten. Gluten is an immune trigger, and our immune system is tied to our gut is tied to our brain, and it's just a domino effect that creates migraines. So number one is remove gluten. Work on bowel function. Make sure you're healing your bowel, eating good nutritious foods, taking a multivitamin, taking fish oil. DHA is the primary oil that's used in your brains, or primary fat that's used in your brain. It's something like 60% of the fat in the brain is DHA, and DHA is one of the main components in fish oil. So if you eat salmon, it's pretty much 60-70% DHA. You can also take fish oil supplements. All of them have DHA in them. And then, of course, the anti-inflammatory stuff, the curcumins and whatnot, can help migraines. So if you're struggling from chronic sinus infections, I would really encourage you to either seek out a functional medicine doctor to see if they can help you with the migraines and not the sinus infections without antibiotics. You'll, of course, need to do a lot of gut work, because with the recurrent, frequent antibiotic use that you've been using, you've destroyed many of the good bacteria in your bowels, and there's an overwhelming amount of bad bacteria and probably yeast, and that is triggering your immune system. And whenever the immune system is triggered and rampant, it's looking for something to fight. So you might actually be getting more sinus infections. Not all of them may be sinus infection, but you might be getting more sinus infections because your immune system is ramped up. But first and foremost, try some migraine medicine. If your migraine, headache, or sinus infection goes away, then you know it wasn't necessarily a sinus infection, and you can save yourself some rounds of antibiotics and balloon sinuplasty and all that stuff. I've never had ENT surgery, but many people will tell you that it's probably one of the most painful surgeries that you can go through, other than shoulder surgery. Shoulder surgery is pretty bad, up there on the list too. So anyway, that's enough about sinus migraines. I just want to put that little seed in your brain and say, if you're developing a sinus infection, think about sinus migraines instead, especially if you're recurrently getting them. Feel free to leave a comment, ask a question, share this with someone who you know that gets recurrent sinus infections. Maybe we can save them some rounds of antibiotics and a lot of misery. So I hope this is helpful. Take care, guys.